We'll call this meeting to order, and the first order of business is approval of the April 20th, 2021 minutes. Do I have a motion? Betty, second by Eden. Are there any changes, comments? Okay, all those in favor? Aye. Any nays? Okay, moving on. Informational items. Our first order is Board of Health. Monica?
Hello, can you hear me?
Yes.
Okay. In your packet is the Board of Health minutes from April. Part of the things I wanted to highlight in here is that we did do a presentation on our iSpan grant. This is a grant that we have through the Illinois Public Health Institution and the Centers for Disease Control and Prevention, or CDC, around nutrition, physical activity, and breastfeeding. This is a multi-year grant, so it was a review of all the practices that they have been doing and kind of the advocacy work that has been done through the iSpan program. In addition, you'll see also we presented on our second core program area, which is our emergency management and preparedness program. Last month, we also did our epidemiology and clinical services, another one of our core program areas. I'm more than happy to answer any questions regarding the Board of Health, and I would like to just acknowledge that our Board of Health president, Dr. Armour, is with us today.
Dr. Armour? Okay. Are there any questions for Monica? No questions? Okay. Is there a report for care and treatment?
So for care and treatment, last week they had presentations for the grantees. The board will be meeting again on June 9th for issuing rewards for the presentations that they had.
Okay. Any questions on that? Okay, moving on. EMA. Jason?
Good morning. I almost said afternoon. I'm used to being at 1 o'clock. So I believe I submitted a report, and hopefully you can see from that, at least at the significant events with our COVID-19 activities, they are decreasing in what I'm reporting on what we're doing. I probably made mention at a previous meeting, but Monica and I have this discussion every day. I keep pushing her. I'm ready to demobilize things and move on, and I think that both as a county, as a health department, and then as a community, and I think we're very near that point. We'll be moving on. So as that goes, there's a lot of just back to normal EMA grant activity or grant type things we're doing. So we have submitted our quarter 5 report. Since I provided this, we've submitted our I think it's the FY22 grant application. We're continue these meetings. We did take an opportunity this spring specifically and met with our weather spotter team. Typically we do a weather spotter training every spring, but this year due to COVID there wasn't, they were online trainings, so we have met twice with the spotter team and communicated with them pretty much on a weekly basis. We've been waiting for severe weather, so we're happy we haven't had that, but it makes it difficult at times to keep our volunteers engaged. So I try to keep in touch with them. We are participating with the Peoria Area Maritime Security Council, so I sit on that as the chairperson for that council, and they're going to be doing an exercise this summer on the river, and so I'm participating in the planning meetings for that. The training attendance, I actually have nothing underneath that, but it's ironic. This week I'm participating every morning from 7 to 11:30 with FEMA on an intermediate EOC functions virtual thing that they're doing. So we have a little bit of training going on. Equipment status and outreach has been pretty much status quo for this reporting period. And then underneath miscellaneous, you'll see that we have submitted our accreditation to EMA for the next accreditation cycle. And our emergency operations plan has been approved. And so we're just waiting for our accreditation approval from EMA. And other than that, we're looking forward to new threats and hazards and how we can prepare for what those threats and hazards pose as we move forward. So anything specific for EMA?
Any questions? Go ahead, Eden.
Just as a clarification for the accreditation submission, is that a reaccreditation? Are you already accredited?
Yes, yeah. So IEMA requires its accreditation is a 3-year cycle. So and I think that the accreditation due to COVID, there was a gap between where the date actually expired. So we resubmitted everything in correspondence with our regional coordinator at EMA. We don't anticipate any. I think it's just waiting to go through the paperwork process.
Can you talk a little bit about weather spotters? How do people, what do they do, and how do you volunteer to do that?
Sorry, I didn't know where the question was coming from.
Oh, sorry.
Okay, yes. Yeah, so weather spotters. So what we do with our weather spotters is basically they're just EMA volunteers. The majority of them only want to do weather spotting, so they do go through a training. We do have a handbook for the weather spotters, and then a typical activation of a weather spotter team would be, I've been watching the weather a little bit. They're calling for some severe weather. Sounds like Thursday. So every morning I get an email from the weather service that lays out kind of how things are going to be. Today there's no chance of severe weather this afternoon. There's a chance of thunderstorms, but not severe weather. So we're not. Thursday morning, if severe weather is anticipated, we'll send an email out to all the spotters and say, hey, look, we may need to activate. So when we activate our spotters, we have a couple individuals go to the EMA bunker, and then we have spotters in the field. Some spotters spot from home. We do have a handful of spotters that'll spot from field locations in the county. We've got some historically good spots to spot from. So some areas that's pretty wide open where they get a good view to the west. And then they communicate with us throughout that process. Some individuals may be aware the city of Peoria no longer sought accreditation for their Office of Emergency Management, so by default we took on those responsibilities. And I've met with the lead weather spotter with the city last week, and they're going to jump on our team. They seemed open to that, and I have a meeting next Wednesday, I think, with the Emergency Communications Center to meet with Dave Tuttle's replacement, and just to make sure we're still firmed up on our communications, because we do use the county's P25 system with our weather spotters to communicate. So,
Any additional questions? No? Okay, thank you.
all right, thanks.
Regional Office of Education. I want to start out by thanking you for the book. I look forward to reading it.
I don't know if that's a book that you will enjoy as much as it's incredibly informative, and I think it will speak to you in some very plain language that helps you understand a lot of the trauma concepts that we work on in the Peoria office, a couple of which I'll touch on today. So, Peoria Regional Learning Center, your high school that supports students that were not successful in their home high school and come to our alternative school, had graduation last week. Put 12 more kids with diplomas out into the world that would not have received them otherwise, and we invited our 2020 graduates to come back if they wanted to walk in a cap and gown. We had a very small ceremony. Even I couldn't attend because we wanted to make sure family could. So that's very exciting. And they are done with school, as are most of your schools in Peoria County. Peoria Public wraps up this week. So everybody should be done and out by Memorial Day. Hallelujah. It was a run the clock out situation. We just needed to go home. Okay. So from that, I mean, seriously, what a year. Because of that, I've been trying to get my superintendents and administration throughout the county to join me for like a retreat reboot. I want to put together a time capsule, and I'm going to write on it, open in 50 years, and I'm having every school district contribute to this time capsule. I'm calling it a retreat reboot, so we're doing that in June as I finally, because they're not thinking, they haven't even made all their plans yet for next year. So at this retreat and reboot, I'm going to do some things with them to energize them, and we're going to talk through some various things for next year. But I want you to understand we're pretty much in the same boat today that we were in June of 2020. We don't know. Mask mandate? I don't know. Social distancing? Probably. You know, just like there's a lot of questions and things that we're still going to be preparing for. But I will guarantee you we will all be back face to face. So that is coming in June. Another event in June I'm very excited about is I am hosting with my partners at ICC and at the Greater Peoria Economic Development Council a college and career readiness reboot. COVID hits, kids can't go do internships, apprenticeships, college and career readiness activities. So we're calling that a reboot as well. Like, okay, it's time to get back on this. The indicators from the state of Illinois are dropping, and you have to be accountable for those next year. So we're hosting that on June 2nd, and we've got some really great things planned for that. I'm very excited about it. I wanted to let you know that we've been planning and moving forward with our Handle with Care Smart Alerts, which is the budget that we're going to use, part of the money from here, and then money that is in grants for years 2 and 3, where police report alerts drop by address, and then that can get sent to the school. Peoria Public has already done a pilot of that, and it was very successful. And we've handpicked a few schools within Peoria County that we want to move forward with. And if you read the book, you'll understand why it's such a big deal that if you were up all night because of domestic violence, shots in your neighborhood, etc., why that's such a big deal that at the school we be prepared for that child. There's training that goes with that to support school personnel so they can actually deal with that. And then I wanted to conclude on a positive note. I am still, if you did not watch The Voice last night, I am lit. Victor Solomon, like, I started bawling. Okay, did anybody else watch it, or is it, thank you. Was he not just the single most, he was on the 2017 Peoria High School football team that won the state championship, okay? And last night, he's on The Voice, brought the house down. John Legend said it's the best performance ever on the show. Google it. Watch it. It will make your day. Peoria High 309 in the house. And in addition to that, about 2 weeks ago now, Brian and I went to Kendrick Green, same team, same class, 3rd round draft to the Pittsburgh Steelers. And as we like to say about the photo, the Pittsburgh Steeler was in the middle. You know, and it just, great things are happening with the kids in Peoria County. I cannot tell you enough good things. And, you know, there's hard things, but wow, are there some great things. But promise me you'll go watch Victor, because it was awesome. As you can tell, I was a little excited. Any questions for me? Sorry.
Any questions for Beth? Go ahead.
I know from teaching at the university level what a traumatic year this was. I think both for educators and students. I think I feel far more for my students than me. So thank you for all the hard work, and I think we're going to be spending a couple years helping our students through this as we go along. Have you heard anything about a vaccine mandate for kids who are old enough to have it?
No, but I've heard about vaccination incentives, potentially, of things you might be able to do athletically, things you might be able to do in terms of mitigation with masking and social distancing in your school, but nothing about a mandate as of yet. I think, Monica, they think it might drop under 12 by September-ish, which would be huge. Walgreens reached out to my office, and I hooked them up with local school districts. Elmwood hosted a clinic for 12-year-old and up. 75 kids, that's a lot for Elmwood, went and got vaccinated. So it's happening out there. So I'm very excited about that. I am hearing college and universities doing it, though.
Yeah, Bradley is on the cusp, so I'm not sure what we're going to do. But same thing, though, that there are going to be incentives for athletics and going on trips and stuff. But yeah.
Any other questions? Beth, thank you. Okay, moving on to sustainability and resource conservation. Becca, hello.
I'm excited, but I don't know if I'm as excited as Beth. I'm going to try to be. So good morning. I just have a few updates. In terms of collections, the electronics collection did receive 270,000 pounds of electronics. That was the last week of April. So definitely a well-received event. The composting, under composting, we did give out we're working on still giving out 3 starter packs for the kiosks. And next month I'll update you on Peoria Heights did approve funding for a kiosk as well through our rural recycling grant that you saw last fall. Landfill committee, there's a few things this month. One, there's a resolution in your packet that will follow, and also Chris Coulter is here to give an update on wetland and lake and dam rehabilitation stuff, or remediation of the wetland. And then The electrical and natural gas usage for the first quarter are included in the packet. Electric usage for the first quarter was down 3% over 2020, and still, it's been a very mild start to the year in terms of the weather. But also, I'm not sure that everyone was quite back in the office yet in the first few months of the year. Natural gas was down 10% over 2020. And that is what I have, unless there are questions.
Any questions for, go ahead, Jennifer.
Did you say you have more starter kits for the composting still?
We may need to draw another name. One of the people didn't pick up, but we may do another giveaway a little later in the year. But we gave away 2 starter kits. There's a kiosk on Adams Street at Sous Chef. Peoria Heights will have one soon, and then we have a meeting tomorrow to discuss another one.
So are there any plans to do, since I know with the electronics, we had to shut it down like a day early and then it was raining or something. So is there any plans to do one of those again in the near future?
Yes, we are planning to do one in November. Kusakowski did reach capacity. That was the main reason for shutting it down. I mean, the weather was part of it, but because they reached capacity. So they did, some of the people who were turned away were able to drop their items off the following week for free.
Okay, thank you. Any other questions? Okay, moving on. We are at the joint resolution, FY 2021 appropriation in Peoria City County Health Department budget to reflect FEMA public assistance funding. Motion to get this on the floor. Eden, second by Linda. Okay, Monica?
So in your packet is a resolution for FEMA public assistance funding specifically for a project around vaccinations. This has been a unique year for public health. We've received supplemental funding to help us for this response efforts. A lot of the funding that we receive as grants are very delineated to certain aspects of the response. We did receive a grant from the state for $400,000 for vaccination clinics. That's what completely towards our Headington Oaks facility with our staff's time, overtime, along with the facility upkeep. But part of our response was we did a lot of outreach and mobilized clinics. And so with that, the state requested that we seek out funding from public assistance and FEMA to support the mobilized vaccinations. So we are requesting $500,000. It is completely reimbursable. However, with our budget, we need to have a budget adjustment to not only accept this this reimbursement, but also issue those funds out. So more than happy to answer any questions.
Any questions? No questions? Okay. All those in favor?
Aye.
Aye. Any nays? Okay. Thank you. Okay, we'll move on to resolution. Third amendment to the landfill agreement. Can I have a motion on the floor, please? Phil, second. Kate? Okay. Who's going to be talking about this one? Becca?
So on May 12th, the landfill committee did pass the third amendment to the landfill agreement, the third active site of the landfill, landfill 3. Again, that landfill agreement was decided on, became effective in December 11th of 2009. This amendment looks at the 4 drop-off locations that were included in that agreement. One of those sites was no longer deemed reasonable. So the city and the county did meet to talk about a few other locations, but PDC did have one that they proposed, and that's what was amended. Was one of those sites was moved from Altorfer Road to Mossville location.
Okay. Are there any questions? No questions? Okay. All those in favor? Aye. Any nays? Okay.
Aye.
Thank you, Rob. Okay, so we're moving on to discussion, and the first order is landfill wetlands update by PDC. I want to welcome Chris Coulter.
Thank you, Madam Chairman. Can you all hear me? Can you all hear me now? Okay. Well, first of all, thank you very much for your approval of the Third Amendment to Landfill Agreement. Basically, what happened is that we proposed a recycling drop-off location for our PDC Laboratories facility in the Pioneer Park area. And that facility has grown a lot. There's just a lot of traffic, and just for safety reasons, we just didn't feel comfortable having a staging area for recycling, especially when it was in the back part of the lot. You're having to go through a lot with over 100 employees there and other municipalities dropping off samples. So we, if you remember, the old McDougall Hartman location, construction company out on Old Galena Road in Mossville, we actually acquired that company in 1999, renamed it Coulter Construction. So there's a map that you'll see that I handed out for you. And so anyway, that's what we proposed as a alternative location for that site. And the other good thing is this also sits in the county. So obviously the county needs these type of services. So anyway, thank you very much for your approval today. What I wanted to do, I'm going to be back here again. If the chairman would like me to come back, and that is to discuss kind of the next phase of the Peoria City County Landfill project. So you'll see I handed out a presentation, and this is also in your packet today. But what I'd like to do is turn your attention. If you'll see that there's page 1. If you go to page 2, you'll see at the top it says site map existing. And when you come into the entrance of the Peoria City County landfill facility, you're going to have to pass a strip mine lake that's to the left. And of course, this property used to host underground and strip mine operations back in the 30s, 40s, and 50s. The site was owned by a Sarco, and then eventually it came to its capacity, and I think the company ended up going bankrupt, and anyway, the state ended up getting the property, and the county and the city ended up acquiring this property to develop a landfill back in the mid-70s. So that strip mine lake was actually formed, because of coal mine strip mine coal operations. So the landfill began in 1976, Peoria City County Landfill number 1. That reached capacity in 1998. We were the operator of that site. Waste Management took over the operation of Peoria City County Landfill number 2 in 1998, and they plan to reach capacity by the second half of 2024. Okay, so as regulations change pertaining to this strip mine lake, and the entrance road that you can see is basically acting as a dam for that lake. So if that lake would happen to, overflow that road, there would be a major downstream impact on neighboring properties, also, Route 8. And so things have changed. The Illinois Department of Natural Resources, has identified this as a hazard. And there was an agreement between the city and the county and Waste Management, to address this. So anyway, you can see Cottonwood Road, where you come off the entrance road, which is labeled Main Dam. There's the scales, which all the trucks have to pass through before they can dump at the landfill, and then there's the public drop-off site. So if you turn to the next page, and it says Site Map Proposed, this is how things are going to change with the strip mine lake, assuming we get our permits approved by Illinois Department of Natural Resources and the U.S. Army Corps of Engineers. So what we started looking into, and this was actually kind of prompted by discussions with the Peoria Park District, when we developed the first phase of the landfill, we're going to have to destroy a wetland. And the only way we can destroy the wetland is if we end up replacing that wetland, actually, and make it a better wetland than what we left it. So we had an arrangement worked out with the Peoria Park District to actually enhance the wetland that they have at the Vickery Bottom site on Kickapoo Creek Road. And we came to an agreement with them in 2011 to do this. And then by doing that, the U.S. Army Corps of Engineers said, okay, then you can disturb that wetland in developing your landfill project, okay? Well, what happened in 2019, we had one of the wettest springs on record, if you remember. I know it feels like we're having the wettest spring on record now, but it was one of the wettest ones on record the first 6 months of 2019. And had we built that wetland and made the investment that we did in the Peoria Park District site, it would have been destroyed. And the way our agreement was with the Park District is once we built it, we had to maintain it, but then if something happened to it, then they were on the hook for it. So, you know, sometimes things work out for a reason. And the Park District talked to us about, is there a way, you know, that you guys could possibly look somewhere else to do this your wetland mitigation project? We obviously were aware of the dam issue with this site. And so I challenged our PDC Technical Services group to see if we could, what we could do to fix the dam by building, you know, by constructing the first phase of the landfill. Because we're going to exhume over 1.5 million cubic yards of dirt. That's a lot of dirt. And I suspect that when we start this project, it'll be the largest dirt moving project in the state when it happens. And just on just my knowledge of construction projects in the state. So we have a lot of dirt we need to get rid of. And is there a way that we could possibly wrap it into, you know, fixing this dam project? And then the second thing is, can we also somehow tie the wetland mitigation project into also this dam project, okay? So if you turn to page 11, and it's the slide that says external coordination. And actually they're turning to it higher on this screen. Yeah, perfect, excellent. So you can see that basically 1/2 of the lake will remain and the other half of the lake is going to become a wetland. And that light green area, that's what we're going to fill up with the first phase of the construction of the Peoria City County Landfill Project. And by doing that, that's a way that we can get rid of the dirt from the first phase, but also basically turn half of the strip mine lake into a marsh and make it a really beautiful wetland. You'll also see towards the bottom half of the page, there's kind of an area that's kind of outlined. I'm going to guess that color's magenta. And so that area is also going to become an area for a stockpiling of excess soils generated from building the first phase of the landfill. And then the other thing I want to bring your attention to, in the kind of the northeast corner or the top right corner of the screen, you'll see that there's an area that's outlined in red, and it says stabilized outlet channel. So currently, with the strip mine lake, there's a primary spillway that's basically giving relief to that strip mine lake that's discharging onto the neighbor's property to the north. So to get this in compliance and to continue to use this entrance road for truck traffic into the new landfill, we basically have to build 2 spillways. So you have your primary one, which is outlined in green, and now we have this emergency spillway, okay? So this is what we have filed. We filed an application with the IDNR as well, and this had to be included in part of the application, including a operating manual as far as how this is going to be operated in the future and an emergency action plan. So if you then turn to the next page, and if you can go one more. Okay, you'll see that there's a red box that's highlighted here, and that red box is actually on property that's not owned by the city and the county. It's actually owned by the Carmen family, okay? So to basically get the ideal design, we needed to actually construct this emergency spillway on the Carmen's property, okay? Well, in order to do that, we need to get an easement from the Carmens to do it. So fortunately, I've met with the Carmen family, and this actually benefits them because if there was gonna be a spill or a flood, from the strip mine lake, it's gonna impact their property. And then the property to the north of them, which is the Hanley property, which the Carmens and the Hanleys actually are related, okay? So they're a family. So I've met with both of them, the Carmens and the Hanleys. So they understand the value of us constructing this emergency spillway on their property. Now, one of the things that I kind of knew this because I know the family, but they'd actually like another way to get access to their property. Because if you look on the map, how they get access to their property now is to the Pattons that own the property to the east of them, okay? And they have a very small easement in order to access their property from the east. So I've met with them a couple times. So this presentation you have a copy of, this was provided to the Carmens. So this was developed for the Carmens, okay? And so anyway, what they asked for is, could we get an easement or could we get access to our property, through the city and the county and through its property? So we actually went out on May 1st and looked at this, and we're gonna have to build a roadway adjacent to this spillway because we're gonna have to take care of it. We're gonna have to maintain it, so we have to have a road next to it. And so they were like, well, actually, if you just gave us access to the roadway that you're gonna build next to the spillway, that'd be sufficient for us, okay? So anyway, basically what's on the table is the Carmens are willing to give the city, the county, the landfill committee, and our company an easement in this red box, which is basically 3.2 acres, so we can construct this thing, in exchange for either an easement or probably a license agreement, probably over the life of the landfill site, that they can access their property through it. So, I just received a draft of the easement. Well, first of all, I had to get a legal description of this. I got this from Hanson Professional Services, who put these applications together. And I just got a draft easement from Brian McGinnis, who's our attorney. So he's just provided me that. And then he's also provided me a license agreement that's kind of modeled after a license agreement that the landfill committee has issued to other neighboring folks who hunt the property or who have own property next to the property that farm it. So anyway, I'm going to review those. And then my plan is I'm going to send those to the state's attorney, to Jenny, to have her review, get her comments, and then also send it to the Carmen family. And so our goal is that if everybody is satisfied with the language, then the landfill committee would hopefully take action on that at its meeting on June 23. And so if everything goes according to plan, and if landfill committee approves it, then that would obviously come here back to the health committee, and then to the county and then to the city council. But this is kind of the last piece we need to basically take care of this dam wetland project, okay? So it's kind of it's a great win-win. We were able to get this removed off of the Peoria Park District's Vickery Bottom site. They've executed the termination agreement, so we're done with that. We've already got the applications are being reviewed by IDNR and U.S. Army Corps of Engineers. We're already getting some comments back from Army Corps of Engineers, so I think we're going to get their approval soon. We anticipate getting feedback from the IDNR in August. So that obviously, so we kind of solve a number of issues here. And then waste management in the city and the county, they had an agreement in which waste management was going to take care of this. Well, now that we're taking care of it, they won't need to. So here's the deal with waste management and us that we like to accomplish. So what I've proposed to waste management is that we like to get the scale house that they built, the scales, and they also built a heavy equipment maintenance shop that's by landfill number 2. And so what I propose to them is, hey, you basically deed those over to us, okay? In exchange, you don't have to do the work you promised to do to the city and the county. Okay, and so they are good with that, and we've talked about this in open session at the landfill committee meetings, and this works out great because this also allows for a smooth handoff between waste management and Peoria City County Landfill Inc. So they're obviously an engaged, cooperative party. So that's a good thing. So, but anyway, this is really the last piece, before then working something out with waste management. But anyway, that's the plan on that. So I'm sorry it was kind of long-winded. I thought I'd save you going through the whole presentation, but you can see the key pieces of this, how this is kind of lining up. But I was talking to Betty on the way in here, and who would have ever thought that things would be so difficult with the landfill project? So, but that's the environment we're in, and actually it's a good thing. We've come a long way with this industry as far as how technical this has become. But anyway, I think overall for public health and safety, we're not going to have to worry about this strip mine lake ever, wreaking havoc on our neighboring property owners and users of Route 8. So that's the goal. And we have a good place for the dirt, because we're gonna generate a lot of it. So Steve's acknowledging that. Steve knows what over 1.5 million, that's a lot of dirt, isn't it? Caterpillar likes, when you talk about 1 million cubic yards of dirt, that's something that gets Caterpillar's attention. So anyway, Madam Chair, that's my update on the wetland project.
Okay, Chris, I have a couple questions. So I'm wondering when landfill 3 is going to be scheduled to open, and what I'm wondering, I know it's been a moving target, but I kind of want you to walk us through the process of how that is determined.
Yep, a great question. So this is also why it's important we get this thing with the easement done. We should, so assuming we can get, everybody is agreed on the language, we get the approval from the landfill committee in June, we get your approval, we get the county's approval, we get the city council's approval, let's just say by August. That works out nicely because I'm expecting to get comments back from the IDNR. I think our goal is to have this all wrapped up by October, okay, with the IDNR and the U.S. Army Corps of Engineers. Why that's important is because I need that to be wrapped up so then we can start developing construction bid specifications to build Peoria City County Landfill number 3. But we need to have these approvals done before that, and I think we're going to get those. So it's going to take us 2 years to build this landfill. So you got to kind of line this up with the construction season. Usually April to October. Okay. Now it's already soon becoming May because of wet weather, but usually your goal is to get April to October. As far as moving dirt. So it'll take us 2022, 2023. Hopefully we start construction April of next year. So a year from now, we're out there with equipment. So you get everything built by the end of 2023. Then what happens is we file a application with the Illinois EPA for an operating permit. It's supposed to take 90 days, but just because of the issues they've had to deal with staffing, like we're all dealing with, I'm sure you're dealing with the county, we're dealing with at our company, we're figuring it's going to take 6 months to get an operating permit application. So if we file that in January of 2024, we'll receive it in July of 2024. Waste Management is telling us that they're going to be full, in the second half of 2024. So you can kind of see how this is lining up. So by the time we get our operating permit application, Waste Management will be reaching capacity at landfill number 2. And if it goes over and if it ends up being later, that's okay. Because, having a little fudge factor is not a bad thing. But anyway, that's kind of how, that's what their plan is right now. So we've also got the Permanent Household Hazardous Waste Collection Center. And that's actually what we're going to have. This is also going to be important with the transition agreement is, that is actually located. In fact, if you go back to the presentation, maybe we can go back to slide number 2, which says site map existing. So if you look at that, you can see where it says the public drop-off is. Yeah, well, there you go, perfect. So you also see just north of that, there's kind of you can see the roof of a building. Well, that's actually where the Permanent Household Hazardous Waste Collection Center is going to be built, but that's actually your building. So we're going to need to level that building, and build the center. But when we do that, we really need to access that whole area. which means that the public drop-off area, we're going to have, activities are going to probably have to be suspended for a period of 6 months, you know what I mean, while we're building this, okay? So we can get in there, we have clear access site, we're not competing with residents and stuff for safety reasons. So I would guess, you know, probably second half of 2024 is what you'd be looking at building that. Now, the other thing we got to do with that, a siting condition that the county, that you folks, you know, placed on the landfill, which I think would make sense, is that we actually have to present a design for the Permanent Household Hazardous Waste Collection Center to the landfill committee for its approval. So we can't just go design the thing, build the thing. We have to get the committee's approval. That is a siting condition. So what I would suspect is that probably in 2023, that's what we'll focus on. We have actually retained Dewberry to do the design. They actually have done some of this because we actually had to build part of the foundation so that we commenced construction. Otherwise, if we hadn't done that, we'd have to repeat this whole process again. And Lynn Scott Pearson told me emphatically she did not want to repeat the local siting approval process when she was still on the county. She was emphatic about that. I understood that, took that to heart, because I didn't want to do it either. So anyway, that's why we built, you know, part of the foundation already. And so we let Waste Management park their vehicles on it. I've actually asked them to do that just to protect it. So, so we've got that piece, but we've got some time on that yet. So anyway, did that kind of help explain the timing of this? Kate.
Kate, go ahead.
Do you have to have a special permit for that hazardous waste area?
Yeah, so we actually, believe it or not, in fact, I think this is the first pollution control facility that actually has had 2 sightings in one. So when we actually went through local siting approval, and we cleared this with the Illinois EPA, we actually did a siting not just for the landfill, but for this, because this is a transfer station. So now all the materials that are collected will be moved off-site and probably will be sent to an incinerator because it will be hazardous waste. So, but yes, that actually we did a 2-in-1 when we went through that process back in 2011, and so there's 2 separate permits. So there's a development permit for the landfill and there's a development permit for this, which is why we had to build part of the foundation. So.
Any other questions? Okay, Chris, thank you.
Thank you.
Coming in.
Appreciate your time today. Yeah, good seeing you.
Okay, next we're going to move on to Health and Human Services Campus. We have Jamie Harwood here. Hi, Jamie. Do you want to come up and kind of give us a recap on the tour that we did a few weeks ago?
I really appreciate this committee taking the time to come over to the Gift Avenue campus and tour our facility. Despite what it looks like visually on the inside, there is a lot of good heart that goes into what the employees do every day for the county and the citizens of Peoria County. So I just want to say thank you for coming over and taking a look. So I don't even know what to say really. In our building, we operate our morgue regionally, for those who don't know that. And when I say regionally, we have 12 to 13 other counties that come into our building every week to have autopsy services. So just alone in Peoria County, our building did 164 Peoria County cases last year. And then there was a whole nother data set of other counties that come in to use our facility. The condition in our facility isn't suitable for the work that we do. It's designed for about 100 cases annually, and we supersede that by 200 to 300 cases every single year. So it's not conducive for what we do every day for the service of Peoria County. Now, I say that kind of tongue-in-cheek because we do our very best for the citizens every day with what we have. There's some safety issues in our building with loading and unloading bodies from the dock. We don't have emergency wash stations for eyes if we have a spill in the eyes or in the face, or a hazmat situation, an injury situation. As you guys saw in our morgue room, we only have minimal storage because of what we have as far as our cooler system. Ideally, when it comes to autopsy, we would have 2 workstations. I could go on and on and on. Our storage, all of our storage is at Headington Oaks in the basement right now for all of our files. Now, we keep 5 years of files on campus and 5 years of tissue stock on campus, as well as all of our homicide cases indefinitely. So obviously, we're going to run out of space, and we already have. All of our tissue stock is stored where our supply room is, and so we have tissue stock and our supplies all in the same area, which is unfortunate. Man, we're in desperate need of a facility, to say the least. And like I said, we're making do with what we have. 3 weeks ago, I toured King County. King County just put together a facility, a multidisciplinary facility for them, the sheriff's office, and I think their facilities. And while it's a little larger than what we need, the basic premise is the same. It's outdated. It's outdated, and it doesn't meet the needs of our community and really a multi-county area that we feed into. So I know most of you were there for the tour, and again, I appreciate that. I'm open to any questions. I know you guys saw a lot, and I spoke a lot, and I generally talk a lot. So if you have any questions, I'm happy to answer those. And that was really just kind of a high-level overview, so I appreciate it.
Do you have any questions? Go ahead, Jennifer.
Jennifer.
Can you address how you weren't able to do the autopsies on the COVID bodies due to the inadequate ventilation?
Yeah, that's a great question. She asked about autopsies for COVID victims. So we were following CDC guidelines for COVID victims, but there were times where we would have a person who may not have had a positive COVID test, but had the symptomatology to support a COVID diagnosis, but might have had something additional to that. Without a negative pressure room, for ventilation purposes, we were unable to do any kind of autopsies in that room. And if we look at standards, OSHA standards and standards of practice, and a basic standard for an autopsy room, negative pressure is baseline standard operating for our room. So none of those people who were suspected of COVID got an autopsy in our facility because of that. No negative pressure rooms. And not just for COVID, but we talk about patients who might have passed away from a tuberculosis-related illness or any kind of airborne disease. Once we make that cut into the body, you're going to have an expulsion of air come out regardless. So it's a risk. It's a hazard for sure. Even though we use basic PPE, mask, gown, gloves, it's by the CDC wasn't recommended that any COVID victim was autopsied because we didn't have negative pressure, which they do have in McLean County.
Can you talk a little bit about, I know you mentioned Xrays and how what you have to do to get Xrays, you have to actually go off-site?
Yeah, that's a really good question. I appreciate you bringing that up. So practice standard for autopsy on specific cases require radiology. For example, self-inflicted gunshot suicides require X-rays of where that projectile went in. Most often it's in the head. So that requires a trip from our facility to St. Francis for the X-rays of the head. If someone has a gunshot homicide, we do full body X-rays. So it's from head all the way to toe. Every bone, every angle gets an X-ray, so we can locate that projectile for autopsy purposes. Because obviously that projectile is going to be in a chain of custody and a chain of evidence that we're going to need for law enforcement purposes. Those X-rays currently get done at St. Francis. The other thing is babies. Any infant that dies of an unnatural death in Peoria County, or anyone that comes into our county, specifically infants, they have to have a skeletal survey with a read by a radiologist. So we're actually going to do an informational resolution at Public Safety and Justice, because we have to have a contract now with St. Francis for those films to be done. Standard of practice, and I will benchmark McLean County, who is actually smaller than us, has in-house X-ray in their autopsy room. So they can do them right there on campus and on site, where they can do a digital read right there during the process of the autopsy, so they can locate that projectile. So the problem, and I would say this is a big problem, is I have to pay my staff, if it's off hours, to leave our building to go get the X-rays and then to pick up the CDs to come back, so that's ready for our doctor at 9 a.m. for our cases that start. If they had a case last night that was brought in that needed full body X-rays, so they had to come in, take that person to the X-rays, bring them back for our case to start at 9 a.m. today. And this is very, very frequent that we waste overtime dollars to get those X-rays off hours to bring them back so they're ready for our case in the morning for our physician to see the X-rays and also to do the autopsy case at the same time. It's obviously important. Thank you.
Any other questions?
Bill?
Oh, Bill.
You've hit on many of the things, and I jotted down taking my notes and just glancing here at my notes. What it amounts to is we don't have a very professional building equipped as well as the building itself for our professional people. Our people are very professional, but it's difficult for them to work in an inadequate facility. And you are doing a magnificent job of trying to counteract some of these things. And I was not necessarily looking to build a new coroner's building, but after being there, I can see where you definitely need some type of a facility, especially some improvements. When somebody brings a body, you go to that sally port to unload that body, and as you said in your presentation, sometimes the body's falling on the floor or on the ground out there because if you've been there, and most of you have been there, it's terrible for a hearse to back in there to unload the body and so forth, and definitely it's difficult for two people, and if a guy's caught there by himself, it's impossible for him if he starts having a problem, and that's why you said they've had to come out. But the ventilation is poor. You're talking about the task of your people running back and forth to the hospital to get different things and so forth. So I definitely can see that there are problems there. The main problem that we have throughout the county is a major problem for you, and that is storage. Storage, it's horrendous. When you took us into some of those areas and so forth, what you guys had to maintain, for a number of years and so forth. This is valuable in possibly cases that have come up in the past, and that's why you need better places to maintain some of these particular things. And that's all I basically got to say. I probably have some other things on my notes here and so forth, but I'm not going to rehash those, but I want everybody to know he's got problems out there.
When I came into the office back in 2016, the end of 16, we cleaned out multiple rooms of junk. And it was, a lot of it was junk, and we moved, I can't even describe the number of files that we moved off of our campus over to the basement of Headington Oaks just to free up storage. Our physician that we have in our building is one of 300 board-certified forensic pathologists across the United States, where the demand is for 1,000. So we have a commodity in Peoria County with our forensic pathologist. So one of those rooms that we cleaned out is now her office, where she can actually work on reports, look at her slides, to really function as a physician should function in an office, especially with the degree of what we have. The driveway that Phil described has got a 10 to 15% grade, so anytime a cot comes out of a vehicle, it's going to roll, regardless. And then you add weight to that, it's extremely difficult. And it's one of the biggest complaints from our funeral homes that come into our office because of that grade and the safety level of that. I've left my house, I can tell you, 4 times in the middle of the night to help one of my staff get a body off the ground. And that's just the fact of the matter. It's unsafe. And our body storage is in a container with a capacity of 12 bodies. The top row we can't use because we can't we have no physical way to put them into that top row of our cooler system. So now we're limited. And when we talk about the pandemic and we had to activate a mobile storage unit, we probably could have diverted from that had we had enough storage. Now, Kane County has 2 coolers in their building that each hold 65 bodies. One's a freezer, one's a cooler. Obviously, I'm not asking for a cooler that holds over 120 some people, but we do need something sufficient enough for Peoria County, because when our regional counties come in for autopsy, they have to take their bodies right away. And so it's decreasing the efficiency of their work in their offices as well because of our storage issue, not just with bodies, but with files, supplies, tissue stock, etc.
I know one of the concerns I had was around just overall security of files as well as tissues. You had a refrigerator that wasn't on a backup generator. If there had been a fire, there was no sprinkler systems that I saw. Things could happen in a bad situation, and I certainly think those are things we need to try to address.
And regarding those tissue samples, those stock jars, my doctor goes into those probably once or twice a month for pending litigation cases. So the integrity of those are extremely important. I would agree with you. I appreciate that point.
Linda?
Yes. Jamie, I read through both the 2016 matrix study as well as the 2019 facility study by the administration. And I guess what it says is that the space is sufficient. It's the need for renovation to correct what you're describing and what I saw in the driveway, where you would be delivering your clients to the door, and also other things about acoustics. It mentions certainly storage, but I guess what has changed from those 2 studies that would make you feel that you need a completely new building in a new location?
Our volume for our death reports have gone up more than 400 since 2016 to the present tense, and it's an aging population based on epidemiology that we're not going to be able to slow up. And specifically, in addition to that, our victims of violent crimes. We can't consciously move forward in our building, storing our clean supplies that we use every single day in an unsecured area with our tissue stock. It's unconscionable, to be honest. It's dirty. We don't have a wash station. Our roof drains into our kitchen sink and our kitchen, where I refuse to drink water. I mean, I could go on and on and on. I asked facilities to regrade that in the back. It can't be done, apparently, because of the expense. The roof is $800,000, I've been told. I mean, and just for the record, I didn't come to the committee asking for a new building. Y'all came in there and you saw what we're working out of, and a renovation is not going to cut it. It's just not. It depends on what we're going for. Do we want to continue working regionally, or do we want to cut off those other 13 counters? We can drive to McLean County to get our autopsies done. We can go to Sangamon. We can go to Champaign County. It doesn't matter to me. I want to serve, and I got elected to serve Peoria County to the best of my ability. And Peoria County is not providing me the ability to do that. And that's a fact. Y'all been through the building. You've seen it. You wouldn't want your loved one being taken care of the way that we do right now.
Well, I don't think for a minute that I am saying that your building is adequate. I'm asking something different.
Sure. Yeah, our volume's up. I mean, the volume of our counties that come into our building for the services is up. Obviously, our population's up. We have more death reports by more than 400 from last year to just this year, from 19 to 20. So it's going to continue to go up.
Kate?
I missed the tour 2 weeks ago, but I did take a tour with you 2 years ago, maybe. I can't remember
About
when
that,
was.
yeah.
So even though I wasn't there with you all 2 weeks ago, I do have a frame of reference for what he's talking about and what you guys are discussing. The safety issues to me are the utmost of importance. I think it puts our county at a risk of liability for the employees potentially being injured. You know, not only our employees, but if we have other outside entities coming and using that facility for unloading bodies, I think it puts us at risk for an outside lawsuit. And then when you're I had a visceral reaction to the thought of a body falling off of a stretcher. I'm not sure how that happens, and then you do an autopsy and kind of distinguish between the causes of death and something that may occur because of an accident like that after the fact. So there's just all sorts of things that are obviously not in any way ideal. I think that it sounds like building a new facility for you is probably going to be, in the long run, more cost effective as far as, you know, not trying to repair something that's not ideal in the first place. But yeah, the safety issues to me are really, really, I'm not even sure how this has gone on so long, to be honest.
I did provide a mock OSHA survey to Scott, who has that available if you want to see it.
Yeah, go ahead, Kate.
I have a question about the storage. So the tissue storage, is there something that you could do with that? It would probably be an investment to do it, but is there some way that we could minimize the amount of tissue and do some sort of cryogenic freezing type project where you take small pieces of all those samples and then cryogenically freeze them so that you can reduce the volume that you need to store?
Well, they are small. They are small already in those little jars.
Oh. Cryogenic tubes are like this big.
Sure. Yeah, I understand that. And I don't know the answer to that question per se, Kate. It's something I'd have to ask, but the standard of practice is what we do right now that's evidence-based. And they have to be readily available for her to go in and pick out and cut, because she cuts and does her own slides as well. She looks at everything under the microscope in her office. So,
Any other questions? Jamie, thank you for
no, I
taking
really
the
appreciate
time.
it. I sincerely do.
Yes,
Thank you.
Thanks. Okay, we are moving on to ARPA guidance, and that's Scott.
Okay. All right. So this is just a quick primer on the ARP. There will be at a point to be determined in time a policy discussion at the Finance Committee as to how the county will choose to allocate the dollars that are being distributed to us from the American Rescue Plan Act. But just some basics for us. Our allocation is $34,803,420 in 2 equal tranches. Nicole received the first tranche last Monday, so a week ago yesterday, which is exactly half of that $34.8 million number. And the second tranche will be available to us no sooner than 1 year from now. The interim final guidance issued by the U.S. Treasury. Currently, there is a 60-day comment window, and so sometime in July or August, the U.S. Treasury will actually take the interim off that and make it the actual final guidance. But as of right now, there are 6 different categories for how these dollars can be spent. One is in support of the public health response. 2, replacement of public sector revenue loss. 3, water and sewer infrastructure. 4, addressing the negative economic impacts of the virus. Premium pay for essential workers is number 5, and lastly, number 6 is broadband infrastructure. As I said, there will be a broader policy discussion forthcoming at the Finance Committee. Specific to this discussion, based on what is in the interim final guidance, I think there are 5 of the 6 categories that could potentially be used to fund all or portions of a construction project should we go forward with that. And it's basically all of them except for the premium pay for essential workers. Any questions before we move on to the project delivery model?
Questions? Okay, moving on, project delivery model. Scott?
Okay. Apologize, we probably should have gone through these next set of slides at our very first meeting that the committee started talking about this topic, but we're going to do it now. So just some basics about project delivery methods. It's a delivery of a project that consists of planning, design, construction, and other services necessary to organize, execute, and complete a building facility. What are some of those fundamental decisions that we, the owner, must make? What type of method we're going to use, what procurement method we might use, and what will the contract look like. Generally, there are 3 parties that are involved in a process. There's the owner, the designer, and the builder. Under the designer bucket, you can normally put both architect and engineers, usually a structural, civil, and probably a mechanical, electrical, plumbing engineer as well. There's 3 basic types of delivery methods. One is design, bid, build. That is traditionally the most common methodology. There's design, build, and then there's construction management at risk. And then there's a couple of overlay concepts that can be generally applied to all 3 of those. The first is the integrated project delivery, and the second is an agency construction manager. Agency construction manager is where we hold all the contracts, we hold all the risk, but we have basically a consultant acting as a construction manager to advise us. So let's look at each one of the 3 models. The first being design, bid, build, the most traditional of the methods. Just taking a basic 2-year construction cycle for a project, a typical project. You would see that we're involved as the owner for 23 months. The architect and the design is going to take roughly 9 months on an average project. Another 9 weeks to actually go through the procurement process, where we would be at a point from bid documents to when you would award a contract. And then the general contractor and any subcontractors and suppliers are basically working on a 12-month build cycle. Obviously, that could be subject to change based on what time of year we start and weather and all those types of things and any unforeseen circumstances with the site. But that in a typical average project, that's what you would typically see. Most of the design liability rests with us because we're directing the architect and the engineering team to do that design. I'm not going to walk through every single pro and con, but you can see that there are more cons than pros for this type of delivery method. Some key highlights include some lack of input both for ourselves on when we select any subcontractors or suppliers, because that is all being bid by a package from the general contractor. You do potentially have the increased time for delivery because there is less engagement from the contractor on constructability issues early on in the designing and throughout the entire design process. Typically, and we've experienced this directly because we did this process in the construction of the Peoria Riverfront Museum. We saw, it was definitely north of 150 change orders for that project. And when we built the nursing home, which was a construction manager at risk, we actually had less than 30 change orders. So change orders add money to the project and generally increase time, especially if it requires an approval of a public body, because you've got to schedule the time to have published the notice for the public meeting and so on and so forth. And sometimes it's a dollar value that actually is more than just above the committee threshold. It has to go to the county board as well. Design build, that same 2-year cycle. The owner, it's faster, so the project is normally a 17-month type project in this example. Doesn't mean our project would be. The architecture and design process is still that 9 months, but the contractor and subcontractors are engaged early on, which means in concept what we're doing here is we're building it as we design it, and they work very closely together. That means that the design liability shifts from us to the design and build team. And there are a whole host of pros for doing a design build type of project. It's normally most cost effective. As I said, it's normally the quickest. You have reduced risk on us because we shift that risk to the design build team. You generally get better quality because you do have that interaction between the design team and the contractor and the subcontractors to work out issues as they evolve. A couple of negatives. There are limitations in terms of the number of general contractors and that would be able to take on this type of project. And in some places, and we haven't checked yet, but there may be state statutes from a procurement standpoint that would not allow us to actually use this process. We used it for the construction of the intersection at Willow Knolls and Allen, but that was a road project, and so it was in partnership with the city, and the city actually held the contract, and they're a home rule municipality, not a county, so that's how we were able to use this methodology for that one project. We have not yet investigated whether or not it would be possible to do it for this type of building project. Construction manager at risk, which is what we used for the construction of Headington Oaks. The typical time frame for a project here is 18 months, so roughly the same, but a little bit longer than the design build process. The architect and design process portion of it is still 9 months. And you see we get the construction manager, the subcontractors, and the suppliers, again, engaged early in the process so that we accelerate that construction schedule. A good positive is that there is open book accounting, which means that we're able to see what the effectiveness of the project is and how we might be able to save during the construction process and who that then would be applied to. It still has a competitive bidding process, so you're able to award for the various packages that will go into the project, and that is shown as a negative or as a con here. I can tell you from experience with the Headington Oaks project, we actually viewed that as a positive, in that multiple subcontractors for the various trades were able to be engaged in the design process. We had multiple bids for various components of the subcontracting packages. So obviously there was a mechanicals package, a structural package, a concrete package, so on and so forth. And I know the sources that we researched to provide this information here say that typically as a con. I actually found it to be a positive in our construction experience. Another comment, we do have some limited capacity in terms of the qualified firms in the area that might be able to do this kind of work. And it does require some additional owner effort on the front end. So the one overlay that, again, we use this with the construction of Headington Oaks, so we overlaid this on top of the construction manager at risk, is the integrated project delivery. The timelines actually come back to the design build timeline, so it's a 17-month project. And you can see that instead of the construction manager and the subcontractors and suppliers, waiting until the second quarter of the project or even the second half of the first year of the project to get engaged, they're actually engaged from the outset of the project. And then the design liability is shifted to that integrated team. All the positives associated with collaboration get enhanced because of how early on the design and construction team is brought together. It is the process that has the least amount of gaps in scope. So therefore, having a reduced number, or the need for a reduced number of change orders. Like design build, it has cost-saving features to us as the owner. And something that it also has where it says target cost. That's using the example of the nursing home. We did ours with a guaranteed maximum price. And so the contractor and construction manager, once we went through all the final design and all the final processing before we went out to bid for all the packages, we put in writing what the guaranteed maximum price was going to be, and the contractor was required to deliver the project with at most that number, unless we came in the middle of the project and said we want to change something. So that would be an owner-defined change that it would have increased the cost. Most of the things that we did with owner changes during Headington Oaks actually decreased the overall cost because we found some efficiencies and constructability enhancements while we were building the building. Just like design, build, and construction manager at risk, the same process of fewer qualified firms applies here. And while it says it as a negative, trust isn't automatic. That's because you've got to get that design team up and running early, and you've got to build that trust. Whether it be the architectural firms in our community or the general contractors that have capacity to do construction management at risk with integrated project delivery, and there are multiple in our community and region. All of them work well together. All of them are known to us and known to me, and so I would I feel pretty good that we will be able to build a team should this be the direction that we go. Familiar slide as we finish up this portion of the agenda for all of you. We are still at the decision-making point for which delivery method we would use for this project. So, Madam Chair, that's all I have. Happy to try and answer any questions from the committee.
Okay, any questions? You look deep in thought, Steve. No questions? You sure? Okay, Linda? I don't think your mic's on.
Oh,
There we go.
sorry.
Thank you.
I don't have a question, but I wanted to comment again that being in charge of the $28 million library construction project, and I think if you go look at those libraries now, and they're beginning to be 10 years old, there's no deterioration. 3 were completely renovated. 1 was a brand new building. And the reason I say that is because we did a construction manager at risk. It worked exceptionally well. We also paid an owner's representative who reviewed all the bid packages, who looked at value engineering and said, here's something, a material that will be every bit as good, but it's not the designer brand. And I felt as though that was something we needed, even though at the time a professor from Bradley University who teaches construction was on our board and on the building committee. And he wholeheartedly agreed that having a person who is looking out for your best interests only and doesn't, in this case, this was somebody that came here from Iowa, and he had just done a $500 million USDA building. I guess the point I would make is he had a congenial relationship with the architects and with the construction company. But he also, because of his background in construction, went to every project every day and looked over everything so we understood exactly what was going on. And there were some minor things that needed to be attended to, and they were attended to. So I just mention that again because after we built those libraries, and I have looked at some buildings that have been built since, and I'm certainly not talking about Headington Oaks, but some others, and I see the quality of the workmanship there. I would never want that to be the quality of the workmanship we'd have in a new facility for the county.
Thank you, Member Daly. Any other questions? Steve, there we are.
I'll just add on to Member Daly's comments. Again, for the construction manager at risk, I've had experience on, when I was on the school board at Dunlap, we built Hickory Grove School and we added to the high school twice using that same model. I chaired that committee both times, so I know it very well, walked through it, and good experience. The value engineering piece really worked out well. And even we had a risk piece that had to be exercised on the high school expansion where during the construction, the right barriers for rainwater weren't put in place before a heavy rain. We ended up flooding the new construction. The construction manager owned up to it because they led that and they took the liability on under their liability insurance. So again, tying it together, the construction manager knew, and they have their own bonding to cover that. And it wasn't any direct impact to, in that case, the school board. So again, some really positive. I've been involved in, not through that, but other design build, design bid build. So I've personally been involved probably in those three models, not the true integrated as Scott has presented. But the contractor or construction management at risk has been a very positive in my personal experience.
Thank you for those comments, Steve. Anybody else?
Madam Chair,
Yes.
just for the benefit of the committee, we have experience with owner's rep on multiple projects. Even though the museum was a design bid build type of model, we did use an owner's representative, and in that instance, instrumental. While I was not in administration at the time, we did a design bid build model with an owner's rep for the construction of the Juvenile Detention Center and the expansion of the jail in the mid-late 90s. For Headington Oaks, we chose to forego the owner's rep at that time. So we've done major projects both ways, and so the organization does have that experience. Those are the major projects during my 25-plus year tenure with the organization. So whether we used when we built the parking deck across the street or the addition to the courthouse in the early 90s before I came here, don't know, but might have.
Thank you, Scott. Any other questions or comments? Okay, thank you. Now we are moving on to mandated services packet. This is something that Member Daly has asked for, and so that's in the packet. I don't remember how many pages it is, but
it's a lot.
It's a lot.
There was a lot of material to pull together for that, and I don't have any presentation prepared. I'm just, if there's questions from the committee members, happy to try and answer them.
Thanks. Member Daly, did you have any questions regarding?
I do not.
Okay, thank you. All right. So we're at miscellaneous then.
Brian Elchester.
No miscellaneous? Okay, then we'll adjourn this
Oh.
meeting. Oh,
Did you have something, Steve?
Steve?
Kind of the cadence of the next meetings for Health Committee, maybe you just remind all of us of the next 2 or 3, just so I apologize, I did miss the tour of
Yeah,
the corners, and I'd been there with Jamie before, but that was on me for missing that on my calendar. I just wanted to make sure that we don't miss again.
so the next meeting we have scheduled for June 8th at 10:30 a.m., and that will be in this room. Is that correct, Scott?
That is correct.
Yes, today, after meetings are done, we're going to be meeting at Headington Oaks to do a tour.
Right.
Yes, tonight after
Right after, well, we're going to have a quick redistricting committee meeting after executive committee. And I think when we break from redistricting, we'll give everybody, like, say, 20, 30 minutes to get up to Headington Oaks. Go ahead and park in the back, so on the north side of the building, because we'll enter the building from the secured entrance on the back side of the building, because that's where my key is. Just maybe a little bit more detail, Madam Chair, from Steve's question. When you meet on the 8th, we would expect to have a committee action item to maybe try and finalize that project delivery model so that we can start working on the RFP documents to get out on the street. We also, I think we have penciled in to start a discussion or have a discussion about project labor agreement and our both enterprise and workforce goal discussion. So minority, women, disadvantaged and veteran-owned businesses. Goals for enterprise, which would be enterprise for everyone's benefit real quickly, is the value from a dollar standpoint that contractors and subcontractors and suppliers would bring to the project. And then workforce is the actual workforce on the job site. On major projects like this, we typically and historically have issued or have generated goals for each of those categories. And then that's the next major item that we have for the committee to discuss, and then we can go from there. A couple other things I think you, Monica, and I need to kind of flesh out before we get too much further.
Kate?
Maybe I missed this somewhere along the way. We're gonna do an RFP. However, have we decided what our project is going to be, and when do we and how do we decide that part of it? Like, what are we asking for?
So that would be, I would say, in the scope of services for the design and construction team that would be assembled. A key part of that evaluation process will be, do we make major renovations to multiple buildings, or is it more cost effective to construct a new building or a new campus? So that'll be in the scope of work for the design and construction team.
I'm going to be reaching out to each of you over the next week or two to discuss your thoughts on the delivery model. So we can have those discussions. Or I think you can, if you want more information, Scott can answer probably a lot of your questions on that. But I do want to talk to each of you to decide, what model you believe would work the best. Okay, Kate?
One of the things that I've been thinking of, if we're talking about putting different entities onto a shared campus, there have been some discussion, especially related to some of the process mapping that was done for the new software program. And I'd like to see some of that information, and I don't know if that process mapping is the appropriate process mapping to look at, because it may not include some of the, if it's all computer work, maybe that's not something that's relevant, but, physical work, physical interactions, is there a reason that for example, the coroner's office should be on the same campus as the health department? Does that make sense, or are there other, processes in our county that would make better sense? I don't know the answer to that. It's a question of mine.
No, it's a great question, Kate, and that's some work that needs to be done. The process mapping that we referenced in relationship to the ERP project really is process flows for payroll, accounts receivable, accounts payable, how we hire someone, how we discipline and someone when someone separates from the organization, whether it be through a resignation, a termination, or a retirement. Those process maps for that project are really limited to HR and finance. But to your point, there is value in looking at where there's consistency of service delivery, where there are opportunities for better service delivery that we can evaluate through some process mapping as we look at Monica's operation, Beth's operation, Jamie's operation, Becca's operation, and we can certainly work on that. And I would even potentially look at having having some of the fact finding done maybe by the architect in their team, so that we can then map that out and see where the similarities lie and maybe where gaps lie as well.
Steve, did you have something? Oh, okay. Jennifer?
I think when we met at the health department, I had asked for a timeline or projected timeline of what we were looking at for how this decision would be made. The step by step of kind of what we're looking at. I feel like maybe there's still some confusion around the committee as to where we're at in the process of making this decision.
Okay. I think
We'll work on that and get something to the committee.
great, thanks. Steve?
And I think mine may fall into that, more on the funding model. I know we've alluded and we've talked about the American Rescue Plan, but I guess I'd like to understand what are the models that we're looking at for funding. If it's issuing bonds and putting that onto the tax rolls for taxpayers, if it's using some of the rescue funds, I'd like to see this mapped out so we know what our options are. I don't want to automatically think that the rescue funds are just our saving grace and it's money. We need to look at where the best use of funds that we get from all sources for this. So I kind of feel like that, to me, hasn't been well explained. So I don't know if that's another communication or if there's another cadence we need to go through. Because typically, in my mind, you don't go forward to do an RFI or anything until you know how your funding model looks and where the money's coming from to fund it. So that'd be, before I would agree to move too far, I'd want to see those and have some, and I know the American Rescue Fund's got some interim label on the final. Don't know what the impact of that is at this point. I know, Scott, you discussed that, and that's up for review and public discussion. But we need to know all that before we commit spending taxpayers' money.
We'll take care of that. We'll meet and discuss that and get all that information to the committee members. Okay? Thank you, Steve. Any other questions? Kate?
Sorry, one more thought, kind of based on what Steve was saying. I guess my feeling is that whether or not I want to build a new building versus remodel an existing building, to me that decision largely hinges on, how much we want to put into this project. Largely hinges, in my opinion, on whether or not we are able to sell Headington Oaks and get out from under some of that debt. So I don't know how things are going to happen, but I don't know if I'm ready to commit to one idea or the other until some of these other things are resolved, really.
Okay. All right. Any other questions? Okay. No more miscellaneous? Okay. We'll see you all this afternoon, and June 8th. here at 10:30 is our next meeting. Yes, yeah, thank you. We'll be adjourned.